Every pharmacy says it's safe. Doctors call it gentle. But this over-the-counter drug, found in nearly every senior's medicine cabinet, could be silently destroying your kidneys right now. The warnings are buried, the symptoms are invisible, and by the time you notice, the damage may be permanent. In the next 60 minutes, you'll discover why your painkiller routine might be putting you on dialysis and the simple steps to protect yourself that most doctors never mention. Don't tune out. What you're about to hear could save your kidneys or your life. I want to start tonight with a story that still keeps me up. My Aunt Ruth, 74, walked every morning, didn't smoke, always brought a salad to family dinners. The last person I'd worry about. She started using over-the-counter painkillers for her knee arthritis. Nothing heavy, just what she bought at the grocery store. Fast forward a year, she's in the hospital with sudden kidney failure. The doctors were stumped until they realized it was those everyday pills. Ruth never got a single warning, not from her doctor, not from the label, not from any pharmacist. That could be me. It could be any of us. Dr. Harper, why aren't we hearing about this? Are these gentle painkillers actually that dangerous for seniors?
Susan, what happened to your aunt is shockingly common and almost always missed until it's too late. The gentle painkillers you're talking about are non-steroidal anti-inflammatory drugs, or NSAIDs, ibuprofen, naproxen, and yes, even high-dose aspirin. They're everywhere, drugstores, supermarkets, even dollar stores. And here's the hidden danger. After 60, your kidneys start to lose their resilience. They can't process these drugs the same way they did at 40 or 50. NSAIDs work by reducing inflammation and pain, but in doing so, they constrict the tiny blood vessels that supply your kidneys. Over time, with repeated use, even at normal doses, this constriction starves the kidneys of blood and oxygen. It's like pinching a garden hose. The flow gets weaker and weaker, and everything downstream suffers.
So if you're in your 60s or 70s and you pop a couple of these every week for your joints or headaches, you're slowly choking off your kidneys? That's honestly terrifying, Dr. Harper. Why don't the labels shout about this?
They should. But the reality is, the FDA requires warnings mostly for prescription NSAIDs or for very high doses. Most over-the-counter versions only say, ask a doctor if you have kidney disease, not this can cause kidney disease. It's a huge difference. A major Johns Hopkins study published in 2024 tracked over 16,000 adults over 60 for 5 years. They found that regular NSAID users, even at recommended doses, had nearly double the rate of chronic kidney disease compared to non-users. That's not rare. And it wasn't people abusing the drug. It was normal, everyday seniors doing exactly what the box says.
That's almost everyone I know. My friend Marcia takes ibuprofen after gardening, my neighbor uses naproxen for her back, and nobody's ever mentioned kidney risks. And honestly, sometimes I take those too, especially after a long day or when my knees act up. It feels harmless.
It does, and that's the trap. Your kidneys don't have pain nerves. The damage is silent until suddenly it's not. By the time your symptoms show up like swelling, fatigue, or changes in urination, the injury is already serious. A 2023 CDC report found nearly 1 in 5 seniors had some degree of kidney dysfunction, and most had no clue. They thought it was just getting old. And another study in the American Journal of Medicine found only 1 in 10 seniors recalled ever being warned by a healthcare provider about the risks of NSAIDs and kidney disease. But there's another piece almost nobody talks about, and it's hiding in the medicine cabinet too.
Wait, there's more? If the painkillers alone are risky, what else should we be worried about?
Here's where it gets complicated. Many seniors take other medications like blood pressure pills, diuretics, or even certain heart drugs. Some of these, when mixed with NSAIDs, create a triple threat for the kidneys. One large European study from 2022 showed that seniors on a combination of an NSAID, a blood pressure medicine like an ACE inhibitor, and a diuretic were over 3 times more likely to develop acute kidney injury compared to those taking just one or none.
You're describing my medicine shelf right now. I have a blood pressure pill and a water pill, and I take painkillers maybe twice a week. Am I at risk? How would I even know?
You're absolutely right to ask, and so are millions of seniors. Here's what I tell my patients. If you're over 60, on blood pressure or heart meds, and using NSAIDs even occasionally, you need to talk to your doctor right away. Ask for a kidney function test called an eGFR. It's a simple blood test that can catch early damage before you feel a single symptom. And here's an at-home check anyone can do tonight. Look at your ankles and feet. Are they swelling more than usual? Is your urine getting darker or less frequent? Are you feeling more tired for no reason? These could be the first subtle signs your kidneys are struggling. But here's a cliffhanger, Susan. Coming up, I want to reveal the biggest mistake most seniors make when trying to play it safe with pain relief and why it actually puts them in more danger. And I'll share the simple, science-backed alternatives that protect your joints without destroying your kidneys.
I'll be honest, Dr. Harper. I'm thinking about dumping every bottle of pain pills I own. But what if someone's already worried? Is it too late to reverse damage? And is there really a safe way to get pain relief that won't wreck our kidneys?
Great question, Susan. And I promise the answers are more hopeful than people think. The kidneys have a remarkable ability to heal if you catch damage early and make a few changes. There are even new approaches, from specific stretching routines to heat therapy, and some medications that don't carry this risk at all. But most important, never stop or change medications without talking to your healthcare provider. And always tell your doctor or pharmacist about every pill you take, even the ones you bought at the supermarket.
That's a lesson I wish my aunt had heard. I think a lot of our listeners are suddenly rethinking what's in their medicine cabinet. But before we jump into solutions, Dr. Harper, you mentioned a common mistake that actually increases risk, even when people think they're being careful. What is it?
Let's put it this way. A lot of people try to double up for extra relief or switch between different NSAIDs, thinking it's safer. But your kidneys don't care about brand names, only the total stress. In a moment, I'll explain why alternating or stacking different painkillers can quietly overwhelm your system, and how one famous safe brand actually led to a surge in kidney hospitalizations.
Okay, I need to hear this because I guarantee at least half our listeners have done this. Grabbed a different painkiller when the first didn't work. And after the break, I want to ask about the scripts and phrases we can actually use with our doctors to get real answers, because a lot of people feel dismissed or rushed at appointments.
Absolutely. The right questions and a few key phrases can make all the difference. We'll get into that. Plus, the story of the painkiller shuffle and what every senior needs to know before reaching for that next pill.
You've got me worried now, Dr. Harper. I think about the times my knee pain didn't budge after taking one pill, so I try a different brand a few hours later, thinking, well, this one's gentler. I'm sure I'm not alone. Is this where we're making a huge mistake?
Absolutely, Susan, and it's more common than anyone realizes. Seniors are especially at risk because pain can be stubborn, and the temptation to layer relief is strong. Here's the trap. Whether you're reaching for ibuprofen, naproxen, or a store brand arthritis formula, your kidneys can't tell the difference. They all put stress on the same filtration system. Switching brands or stacking doses quietly multiplies the strain. A study out of Stanford in late 2023 looked at nearly 30,000 ER visits for kidney complications in adults over 65. The researchers found that almost a third of those patients had used more than one type of NSAID in the previous 48 hours. Most thought they were spreading out the risk, but they were really compounding it. the risk of acute kidney injury doubled compared to those using a single NSAID at a time.
That's scary. And I'll bet most people like me don't even realize Tylenol is a totally different class of drug. But what about over-the-counter combo meds like all-in-one cold relief or PM formulas? Are those risky too?
Great question. Some combination meds contain NSAIDs plus other drugs, and the labels are confusing. A patient might take a pain reliever, then grab a nighttime cold medicine, not realizing it's doubling up on NSAIDs. The kidneys get a hit with a 1-2 punch. A 2024 Consumer Reports investigation found that over 40% of seniors surveyed in the past month had unintentionally taken overlapping painkillers.
That's me. If I have a headache and can't sleep, I'll reach for a nighttime pill, and never once did I stop to check if it's the same drug as my painkiller. What should we actually do when pain isn't going away? Because sometimes it feels like the only way to get through the day is to just take something.
The key is to break the cycle before it starts. First, always read the active ingredient. Don't rely on brand names or PM or arthritis labels. Second, keep a written log, even just a sticky note on the medicine cabinet of what you take and when. It's simple, but in a 2023 trial at the Mayo Clinic, seniors who tracked their OTC meds reduced accidental doubling by over 60%. And third, know that painkillers are not the only answer. Here's something hopeful. A 2024 clinical trial published in JAMA showed that seniors with chronic arthritis pain who combined gentle stretching, heat packs, and guided breathing routines saw a 35% reduction in pain with zero kidney side effects. These aren't quick fixes, but they're real solutions, especially for day-to-day aches.
I love that you're giving hope, not just fear. I'm picturing myself writing down what I take, but also having real options for those days when I'm desperate. But what about those conversations with doctors? I know so many people who feel dismissed, like, you're getting older, just deal with it. How can we make sure we're heard and get real answers about our medications?
This is so important. Let's role play for a moment. If your doctor brushes you off, here's a script. I've read that seniors are at higher risk for kidney problems with painkillers. Could we check my kidney function just to be safe? I'd like an eGFR test. Be firm but friendly. And if you feel rushed, ask for a printout or summary of the visit, or schedule a follow-up just to talk medications. And Susan, you're not alone in feeling hesitant. Recent data from the National Poll on Healthy Aging in 2024 showed that 67% of seniors feel uncomfortable questioning their doctor about medications, even though most doctors welcome it.
That's absolutely me. I feel guilty for taking up their time, or I'm embarrassed I don't know all the names. But hearing you say that, I realize it's my right to get answers about my medications. And I want to repeat this for everyone listening. It's never a bother to ask your doctor how every pill, yes, even the ones from the supermarket, might affect your kidneys or interact with your other meds. Let's make this our medicine cabinet checkup week.
I love that. And here's a quick tip for everyone. If you're ever prescribed a new medication, always ask, is there any reason I shouldn't take this with my painkillers or blood pressure pills? Even if your doctor is busy, you'll plant the seed for a real medication review. And a heads up, next week's episode, Susan, I want to dig into bone health, because there's a similar hidden danger with osteoporosis meds and kidney function. But back to painkillers. There's a true story I think every listener needs to hear. Last year, I had a patient, Mr. Lee. He was 79, always independent, loved woodworking. He'd take ibuprofen for a sore back, naproxen for arthritis, and Tylenol for headaches. never more than the label, but sometimes all in the same day. He ended up in the ER with sudden confusion and swelling. Blood tests showed severe acute kidney injury. He never realized he was stacking drugs because he thought Tylenol wasn't a problem and that switching was safe.
That breaks my heart. And it could have been any of us. What happened after?
With quick treatment and stopping all NSAIDs, his kidneys partially recovered, but not all the way. He has to be extra careful now, and his story changed how I teach all my patients. That's why I say, if you're unsure, err on the side of caution. Even if you feel fine, get your kidneys checked once a year after 60. And always report new swelling, dark urine, or unexplained fatigue immediately, not next week.
I can almost hear our listeners thinking, but I can't live in pain. What are the safest ways to manage pain if NSAIDs are off the table or only for rare use?
That's a crucial question, and the answer isn't no pain relief. Acetaminophen, Tylenol, is generally safer for the kidneys when used as directed, but it does carry a risk for the liver, especially at high doses or with alcohol. For joint pain, topical NSAID gels applied directly to sore spots have been shown in a 2024 Cochrane review to give good relief with far less risk to kidneys since very little enters the bloodstream. And don't underestimate non-drug tools. Heat wraps, gentle yoga or chair stretches, TENS units, nerve stimulation pads, all shown in research to lower pain levels without harming organs. And for tough cases, physical therapy or a referral to a pain specialist can open new doors. But never combine prescription pain meds, muscle relaxers, or sleeping pills without doctor supervision. The interaction risks go way up.
I feel like we're starting to see a path forward. It's not about fear, it's about getting smarter and protecting ourselves. Dr. Harper, if a listener realizes tonight that they've been overusing or mixing painkillers, what's the very first step they should take?
Great question. Step 1, stop all NSAIDs immediately and call your healthcare provider. Do not panic, but do ask for kidney function tests and guidance on pain management going forward. And bring all your meds, prescription and over-the-counter, so your doctor gets the full picture. And remember, kidneys often heal if you catch damage early. We've seen seniors get their kidney numbers back to normal just by stopping the cycle and choosing safer alternatives.
That's so encouraging. And for those who can't get a doctor's appointment soon, what can they watch for at home?
Look for swelling, especially in ankles and feet. Track your urine. Darker or foamy urine or peeing less can signal trouble. And monitor your energy. If you're suddenly more tired, dizzy, or short of breath, don't wait. Get checked.
This is the kind of information I wish every senior and every family heard before they ever pick up another gentle painkiller. Dr. Harper, thank you for making it real and practical, and for not scaring us, but empowering us.
That's my goal, Susan. And remember, there's no such thing as a silly question when it comes to your health. In a moment, I want to bust one last myth. What about the so-called natural painkillers and herbal remedies? Are they really safer, or do they carry hidden kidney risks too? Because some supplements can be just as dangerous, sometimes more.
Oh, I have so many friends who swear by natural pills, and I admit I've been tempted. Let's unpack that myth. Plus, I want your best tips for keeping our kidneys strong for the long haul. And don't forget, at the very end, I want you to share your personal kidney health routine. Doctor's honor. So, Dr. Harper, before the break, you promised to tackle the big question about natural painkillers. I have neighbors who swear by turmeric, willow bark, even something called devil's claw. Is it safe to think that just because it's natural, it's safer for our kidneys?
That's such a common and risky misconception, Susan. The truth is, natural doesn't always mean safe, especially for seniors. Some herbal pain relievers can actually be harder on the kidneys than over-the-counter drugs. For example, willow bark contains a compound similar to aspirin and can cause the same kidney stress as NSAIDs. A recent analysis published in Kidney International in late 2023 looked at the top 10 most popular herbal pain supplements. The researchers found that at least 4, including willow bark, devil's claw, and high-dose turmeric, have been linked to cases of acute kidney injury, especially in people over 65 or those with high blood pressure.
Wow, I had no idea. I think we all want to believe there's a magic solution that's gentle and won't do harm. Are there any natural options that really are safe, or is it just better to stick with proven therapies?
There are certainly supportive lifestyle habits like anti-inflammatory diets, staying well hydrated, using ginger in cooking, gentle exercise. But if you're considering a supplement, always run it by your doctor and pharmacist. The FDA doesn't regulate supplements the same way as prescription or over-the-counter drugs. In fact, a 2024 government report found that nearly 30% of herbal products sold in stores or online were contaminated with heavy metals or undisclosed ingredients, many of which can stress the kidneys.
So what I'm hearing is, when in doubt, don't just try it and see, especially if you have other health conditions or take other medications. You promised to share your personal kidney health routine, so I have to ask, what do you, as a doctor, do every day to protect your own kidneys?
I get this question from patients a lot, and honestly, I keep it very simple, and I always try to practice what I preach. Here's my real routine. First, I drink plenty of water, but not too much, just enough to keep my urine pale yellow. Second, I avoid NSAIDs unless absolutely necessary, and if I must take them for pain, I keep the dose low and the duration short, never stacking with other meds. Third, I get my blood pressure checked regularly because high blood pressure is the number 2 cause of kidney disease after diabetes. And finally, I try to keep active. Walking is my medicine. Studies show regular movement helps kidneys filter waste more efficiently, even in older adults.
Dr. Harper, before we wrap, I want to address the emotional side. For so many seniors, pain isn't just physical. It's lonely. There's fear, frustration, maybe even guilt about asking for help. What do you say to the person listening right now who's scared they might already have damage or who feels overwhelmed by all this new information?
You are not alone, and it is never too late to get help. Kidneys can often recover, at least partly, if you catch trouble early. Don't feel ashamed for not knowing. Most people aren't told this. The most powerful thing you can do is take the next small step. Call your doctor, bring your list, ask the questions, and reach out to loved ones for support. Pain and kidney disease are both isolating, but you do not have to face them in silence. There are solutions and support available.
That's why I'm so grateful for these conversations, Dr. Harper. You always remind us that knowledge is power and that just listening, just caring about your health is a step toward healing. So for everyone tuning in, maybe tonight you clean out your medicine cabinet, or call your doctor in the morning, or just share this episode with a friend who needs it. And keep asking questions. No one cares more about your health than you do.
Exactly. And if you ever feel dismissed or ignored, keep pushing. Your voice matters. And Susan, before we go, I want to leave everyone with one last simple challenge. This week, choose one habit to strengthen your kidneys. It could be drinking more water, taking a daily walk, or starting that medicine diary. Tiny changes, big difference over time.
I love that, and I'll be right there with everyone, making those small changes together. Before we sign off, Dr. Harper, can you give us us a little preview of next week's episode? You mentioned something about hidden dangers in bone health?
Yes, next week we're diving into the silent thief, bone loss after 60. Most people think weak bones are just about falls, but new research links hidden bone loss to kidney function, medication side effects, and even changes in your balance. If you've ever wondered if you're losing bone strength or what to do about it, don't miss it.
That's going to be another must listen. Thank you, Dr. Harper, for always making complex science clear and for caring so deeply about seniors' health. And to everyone listening, take care of those kidneys, one smart step at a time. See you next week.